Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation of veins of the neck. In this presentation, I will discuss the origin of the veins of the head and neck region, and veins of the scalp, face and neck will be discussed here, and final destination of the vein of this region, and at every stage I will try to correlate clinically. Veins of the head neck can be grouped into cranial veins, the veins that drain blood from the brain and meninges, and extracranial veins. In this presentation, I will cover the extracranial veins. Extracranial veins are grouped into veins of the scalp, that is marked red in the figure, and the veins of the face and neck, that is indicated by the arrow. The region is indicated here. The veins of the scalp comprises of this labeled here. This is the supratrochlear vein, and this one is the supraorbital vein. So these veins are coming from the anterior part of the scalp and forehead. They unite together to form the angular vein at the root of the nose, and this descends downward as the facial vein. These are the veins of the anterior part of the scalp. The superficial temporal vein collects the blood from the small veins arising in the lateral side of the scalp. The posterior auricular vein and the occipital vein collects the small veins arising from the posterior part of the scalp. So scalp goes in anterior direction, in the lateral direction and the posterior direction. The angular vein collects the veins of venous blood of the anterior part, the superficial temporal, the lateral parts, occipital and posterior auricular from the posterior part. The scalp has 5 layers. These the skin, connective tissue, aponeurosis of the muscle, loose connective tissue, and finally the deepest layer is the pericranium, which is the outer periosteum of the skull. These layers I am telling because I want to express the clinical significance of the venous drainage of this region. Clinical significance of this scalp is here. If the scalp is injured, there is profuse bleeding. The second layer is dense connective tissue layer, and this contains large blood vessels and making the network here. These blood vessels, whenever injured, their walls remains tightly adherent to the fibers. That fibers are made of collagen fibers, and these are making very integrated network. So the blood vessels injured cannot retract to close the injured area, so that produces profuse bleeding. If you see the black eye formation, we can explain this fourth layer is loose connective tissue. This is between aponeurosis and the periosteum of the bone on the deeper side. So this plane is a natural plane of cleavage. This is crossed by the emissary veins also. So injury to scalps causes tearing of the veins in this layer, causing profuse bleeding. But that bleeding spreads in all directions, cannot go posteriorly because of the muscular attachment to the superior and highest nuchal line. On lateral side also blocked by the attachment on the superior temporal line, but anteriorly, the aponeurosis is continuous with the frontal belly of the muscle. That muscle doesn't have any bony attachment anteriorly. So the blood can go anteriorly in the forehead and can continue in the eyelids as well as under the conjunctiva, and this condition is known as black eye, and this is the mechanism of formation of black eye. Emissary veins are the veins that connects the external extracranial vessels of the scalp with the intracranial dural venous sinuses as well as the diploid veins. So these are the connections between the vessels outside the skull and inside the skull. So this allows the flow of the blood in either direction because there is no valve in it. So this is clinically very important, and let us discuss the clinical significance of this emissary vein. So there is some physiological effect. This is connecting the extracranial veins with the intracranial veins. So there is no valve here, so this allows the flow in either direction, and this acts as a safety valve to control the elevated intracranial pressure. This can drain blood to the extracranial veins and reduce the pressure of the intracranial structure. So this is known as this is working as a valve here. So this is known as safety valve to regulate the intracranial pressure, to equalize it. This is the physiological function, and it also helps in temperature regulation. If the intracranial temperature rises, then blood flows to the outside, and the temperature of the blood outside is reduced because of the formation of the sweats, and evaporation of the sweats reduces the blood temperature, which flows inside the cranial cavity and reduce the temperature of the blood of the intracranial sources. Pathological effects is these are the source because of the absence of the valve. The bad elements can go inside the cranial cavity, and we commonly know this is the infection sources. This is the emissary vein connecting the veins of the either side, and there is no valve here. Already we have discussed the veins of the skull that forms the supratrochlear and supraorbital vein in the forehead, and they unite together in the anterior part to join and form the angular vein. So angular vein collects the blood from the anterior part of the skull as well as the forehead. Then it continues downward as the facial vein and continue to collect the vein from the respective side of the face. From the lateral part of the skull continues into the temporal fossa, and they unite together to form the superficial temporal vein as labeled here. This is collecting all the veins from the lateral side of the face and unites with the maxillary vein behind the neck of the mandible to form the retromandibular vein. This is the parotid gland. You can see this is the superficial temporal vein, and it enters into the parotid gland, joins the maxillary vein to form the retromandibular vein. This retromandibular vein remaining within the parotid gland divides into anterior division and the posterior division. You can see in the diagram. This posterior division, you can see, unites with the posterior auricular vein to form the external jugular vein, and this external jugular vein descends. See the facial vein you can see, which is continuation of the axillary vein, unites with the anterior division of the retromandibular vein, and this common vein enters into the internal jugular vein, which is visible in the figure. Danger area of the face is the lower part of the nose and upper lip. Let us explain why this area is known as danger area. The angular vein formation already we have understood, and this angular vein is connected to the cavernous sinus, which is a very nuclear sinus having connection in all directions with the other sinuses. So this any problem in the cavernous sinus can spread in all direction. Also, blockage of this causes edema of the orbital structure, connection of fluid within the orbit, pushing the eyeball forward. So this is a dangerous condition if the cavernous sinus is blocked. This angular vein with a connecting vein is connected with the cavernous sinus. So these are not having any valve. So venous blood can flow in either directions, from the cavernous sinus to angular vein and angular vein to cavernous sinus. You can see this is the area of the cavernous sinus within the cranial skull. This is the sphenoid bone at the center, and on either side of the sphenoid bone, this cavernous sinus is situated, and you can see the connection. The vein is running in all directions, and all are valveless. In the head, this upper lip, nose, you can see this area within the square is the danger area. The upper lip, lower half of the nose, and part of the gum. So the venous blood from this area through this angular vein and through this connecting vein can go to the cavernous sinus. So bad elements can spread from this area of the face to the cavernous sinus, and this condition is very dangerous. You can see this is the danger area of the face, and you can see a small lesion at the tip of the nose. Overnight created a very serious problem because of the spread of this infection to the cavernous sinus, and the left side eye is in orbit is involved. The neck veins is divided into superficial and deep, and these are actually separated but connected with each other like other places. Superficial vein lies outside the investing layer of the deep fascia, and it includes the external jugular vein. This is the external anterior jugular vein, and this is the external jugular vein, and the third one is the posterior jugular vein. This is the posterior jugular vein, and all aims into the subclavian vein. The deep vein includes the internal jugular vein that follows the large artery of the corresponding area. Let us discuss one by one the superficial veins. Of the three superficial veins, external jugular vein is the largest, and it arises near the angle of the mandible, united of the posterior auricular vein and posterior division of the retromandibular vein, and it terminates into draining into the subclavian vein of the corresponding site. This is the external jugular vein, and this is the subclavian vein. The anterior jugular vein you can see in the photograph. This begins below the chins by the union of some small veins which are not named, and it terminates into the external jugular vein and finally opens into the subclavian vein. The anterojugular vein, after entering into the supraesternal space, it joins the external jugular vein. This one is the anterojugular vein level here. You can see the subclavian vein. Before joining the subclavian vein, this anterojugular vein joins the external jugular vein. It is shown in the either figure. Posterior jugular vein is relatively smaller, arises, this is the confluence actually of the superficial vein of the occipital region, and it goes downward to join the external jugular vein, and after that it opens into the subclavian vein. Let us discuss the deep vein. These are the dural venous sinuses, and finally the dural venous sinus form the sigmoid sinus. You can see the labeled sigmoid sinus. This is the sigmoid sinus in the skull, base of the skull, and these are the two sigmoid sinus in an open area. So this sigmoid sinus passes through the jugular foramen to become internal jugular vein. You can see this is the jugular foramen and it continues as a sigmoid sinus, and then at the level of the jugular foramen it becomes internal jugular vein. You can see this internal jugular vein is coming out of the skull and joins the structures of the carotid sheath, and it collects the blood from the brain and skull and superficial part of the face as well as from the neck, and it descends downward in the carotid sheath with the other structures. You can see the carotid sheath here, and it is with the internal carotid and the common carotid artery and the vagus, which is yellow in color here. You can see the internal jugular vein descending downward from the jugular foramen and finally joining the subclavian vein posterior to the sternal end of the clavicle to form the brachiocephalic vein of the corresponding side. You can see the brachiocephalic vein of the left side is longer and goes to the right side, and the brachiocephalic vein of the right side is relatively vertical and continues as the superior vena cava. This is the left. You can see the left brachiocephalic is more oblique and the right one is more vertical, and together making the superior vena cava, which opens into the right atrium. These two structure lies behind the manubrium the sterni. You can imagine the position. The upper part of the manubrium sterni is obliquely crossed by the left one, and the right one remains relatively to the right side. Finally, the blood is drained into the right atrium. What is the clinical significance? You can see the sternocleidomastoid muscle insertion, sternal head and clavicular head. There is a V-shaped area between these two heads, and in between these the superficially lies the internal jugular vein. So internal jugular vein is very easy to find it out, and the common carotid artery lies much deeper. So if we place a needle in this area, easily it can be placed within this vein, and in an emergency situation we can send the blood, we can send the medicine into the blood and into the heart directly if we can puncture this one. So this vein is clinically important in life-saving cases. You can see a central venous line is established by placing the cannula in the internal jugular vein, and the cannula has sent to the heart in the right atrium. So easily you can send the devices into the right atrium to see the walls of the right atrium to do some operative procedures. Thank you very much for being with the presentation.